In today's video, I'm talking about a patient that came to see me because he was suffering from a very painful case of shingles. Shingles can create very painful rashes on different places in the body, and from that it can develop to nerve pain. So it's a very serious problem, but acupuncture can help a lot in treating it. So let's look at the case of this particular patient. If you'd like to learn more about the techniques that I show in my videos, check out the courses I have available. I have balanced method acupuncture courses, both in English and in Portuguese, that you can purchase and learn about this technique. This was a 42-year-old male patient, and he presented with a case of shingles. If you've seen cases like this, the most common places for us to see them are the rib cage area or in the face. In this case, it was an unusual presentation because it was on his left buttocks, all along this area here. It had been developing for 5 days when he came to me. He had a very big rash. It was very red. Parts of it were already creating wounds, and it was very painful for him. He had already gone to the doctor who diagnosed the shingles, and he was taking medication for the pain, which was not taking it completely away, but making it bearable so he could sit and walk around. So let's look at what we can do with acupuncture and how I approach this case. First of all, if we're applying balance method or anything related to channel theory, we need to see which channels are affected. And in this case, obviously, we have here the bladder channel. So affected channel is the bladder. From here, we need to start creating a strategy to help this patient. So we know the affected channel, we know the area that's affected. Now we need to choose what points we're going to apply. And in this case, we could debate, should we use a local balance or a global balance? If you don't know these concepts, what's a global, what's a local balance, check out my courses and you will see what I'm talking about. As this is a complex situation, you might feel tempted to use a global balance, which is usually better for internal medicine and for more complicated problems. But in my experience, we get better results if we do 4 separate local balances instead of a complete global balance, even if all the channels don't follow the rules of a global balance. So what I did was, in each of the limbs, I chose one channel that would balance bladder. So if we look here, so to start in the opposite side upper limb, so his right arm, I decided to use the small intestine. As we know, the small intestine balances the bladder through system 1. And in this case, I used a reverse mirror. So I decided to use the hand to represent the area of the hip and the buttock. So I searched for acupoints between small intestine 3 and small intestine 4. On the arm on the same side, so his left arm, I used the lung. The lung balances the bladder through system 2, so we can use it on the same side as the affliction. And here I used at the same time both a direct and an inverse mirror. So I used an inverse mirror as we've done with small intestine. So I searched for acupoints around lung 10, but I also used the direct mirror. So I used the shoulder to represent the hip. So I searched for acupoints in the area of lung 1 to lung 3. Now we go to the leg. On the opposite side leg, so his right leg, I used the kidney. The kidney balances the bladder through system number 3. And here, again, I went for an inverse mirror, so I used the foot. So I searched for acupoints around kidney 6 and kidney 2. And on his affected side, or his left leg, I used the bladder. and I use bladder 65 as the guiding needle. This is a technique that comes from Dr. Yang Wei Xie, in which we can use the shoestring point of the affected channel as a guiding needle to direct the treatment. So I ended up using one needle on the small intestine channel, one needle on the kidney channel, one needle on the bladder channel, and 2 needles on the lung channel. And after the 30 minutes, he described that he was no longer feeling the same kind of pain and that the feeling of heat that he had was going way down. We booked another session after 3 days, and when he came back, he told me that he had almost no more pain, that the rash was starting to dry up, but now what he felt was a lot of itching. In the beginning there was no itching, there was some heat but no itching, and now he was feeling a lot of itching and almost no pain. So I kept the same treatment, but in the beginning I bled the area of DT01 and 02. This is a set of master tongue points on the back. This is on the small intestine channel close to the shoulder, and these points are amazing for anything related to itching. Master Tung describes these points as cleaning the blood. I bled this area using a cup, so I did wet cupping, and after that I used the same channels that I used in the first session, Osha points, so another 5 needles, and I sent the patient home and we booked a third session after 1 week. When the patient came back, he told me that there was absolutely no more pain and that there was no more itching. Actually, he reported that since we did the bleeding on the DT area that he stopped feeling the itch and it never came back, and that his rash was still drying up, but it was still not completely dry. So in that session, what I did was I still kept the same points of the balance, but now instead of bleeding DT01 and 02, I bled the point 11.26. This is a point that comes from Master Tung. It's on the hand, and it's very useful to help wounds close. Oh, and the areas we bleed, the DT and the 11.26 were both on his left side. I usually bleed on the same side as the illness. After we did the treatment, I sent the patient home, and we didn't reschedule an appointment, but I called him after 5 days and asked him how the recovery was going, and he told me that the rash was almost completely dry and there were no more symptoms, so we stopped the treatment there. As you can see, with acupuncture we were able to stop a shingles crisis right at the beginning. Shingles can be a very serious problem, especially if you don't treat it and if you let it run its course. It can lead, as I said in the beginning, to nerve pain, and this makes it much harder to treat. Even in those hard cases, acupuncture can help a lot, but you need to have the right tools. That's why I preach that it's important for you to learn about Master Tung acupuncture. It's important for you to learn about bleeding techniques, about the balance method, because these techniques are very powerful and they can really make a difference in the patient's life. This was a case of a very young patient who was suffering a lot from a serious problem that could have gone on for weeks or months and could have turned out a lot worse than it did. And with the help of acupuncture, a few simple needles and a few simple pricks of blood, we could sort this problem out within 2 weeks. So if you know anyone suffering from a problem like this, advise them to search for a good acupuncturist, because acupuncture can help a lot in these situations. Thank you for watching this video. If you liked it, don't forget to like and subscribe to the channel, and I'll see you in the next one.